Hello, so my name is Michael. Thanks for coming and watching my video. So a little bit about myself. I currently am living in Baltimore, Maryland. Prior to that, I spent a few years in Los Angeles, California, and then I moved to Charleston, South Carolina. And then about 6 months ago, I moved back home to Baltimore. That's originally where I'm from. It actually just started raining out. We're supposed to get a little bit of Florence, so just preparing for that a little bit. And as far as my field placement, it's actually where I currently work, which is called Mindula Health. Mindula is a healthcare organization. It's relatively new. They started in 2013. They have two main lines of business. The first is custom case management. That's where clients will come in and pay for therapy, case management services, typically for 6 months up to a year. Those clients usually have healthcare, like CareFirst, Blue Cross, United Healthcare. And then the other line of business is called RRP. It's called Readmission Reduction Program. So there are several hospitals in the DMV area that will contract with Mindula to help patients that are admitted to their psychiatric unit, once they're discharged, help them not be readmitted. So with those clients, we only get them for 30 days. So they'll be admitted to a hospital. Usually the stay is anywhere from 72 hours to a week. And then upon their discharge, they will be enrolled in case management services through Mindula. They'll be assigned a case manager, and that case manager will work with them for 30 days. Basically, some of the things that we can do is provide medication management, make sure once they leave the hospital, they have all their medications. They know what their medications do. They're taking their medications. We communicate with these clients via phone calls or text messages, sometimes email if they don't have a phone. Rarely we meet them in the community. For example, if we need to set them up for disability, we can meet them in the community and go through the application online together. Other things that we do as case managers would be schedule them appointments with therapists. We'll schedule them appointments with psychiatrists. If they have any medical issues, we will schedule those appointments as well. We provide transportation sometimes if they're unable to get to their appointments. A lot of the clients are homeless, so we will connect them with community resources such as crisis beds that usually provide anywhere from 10 to 30 days of living. And we will oftentimes put them on different housing referrals. Unfortunately, housing, we only have these clients for 30 days, so usually getting them into a housing program takes a little bit longer than 30 days. So during the 30 days, we usually just set them up, or at least get them on the waiting list. And then as far as my field placement, so it's actually, my field placement is with Mindula, and that's actually where I work. So I'm doing a little bit of field placement as well as my full-time job. So what my field placement will be doing is working with the readmission reduction program. I'll be the person going to the hospital and meeting with the clients that are currently in the behavioral health unit, and I will be signing them up for Mindula services. So once they're discharged, I have them all signed up so they can get a case manager upon their discharge. So basically what a typical day will look like is I will go to the hospital. It's about an hour from my house. I do this 3 days a week, Monday, Tuesday, and Thursdays. I'll start my day by going into rounds with the hospital psychiatrists, social workers, and case managers. We'll go through each client that is there on the unit. Typically, it's anywhere from 20 to 25 clients. We'll go through their diagnosis, their medications, their treatment plan, how they're doing, their family dynamics. And then I will select about 4 to 5 of those clients to meet with each day. And I will go on the unit and I'll meet with those clients. I'll go through the Mindula intake and assessment. The assessment's about 3 pages long. It's about 30 questions I ask them just to evaluate their needs. I'll get all their contact information, where they're living, if they have a home address. If not, I know that they'll need a crisis bed upon discharge. And then I take all the intakes and I fax them back to the corporate office of Mindula, and then someone assigns them a case manager. I also do, my full-time job is working as a case manager. However, I don't take any of the clients that I personally do the intakes for, just so I can separate that from my field placement. And that's about it. I'm recently new at this company. It's been about 6 months, so it's going well. I'm really fortunate that they allowed me to do my field placement there, so pretty thankful for that. And my supervisor, her name is Amy. She is MSW. She's great, very good with clients. She's a good mentor. And my field instructor her name is Mercy. She's great also. She is an MSW. She's been out of school for about 2 years now. Supervision is going well. We have great communication, so no complaints there. And that's about it. So I look forward to hearing what you all are doing, and I'll talk to you soon.